Yesu Krista chaneka wajinosti damay jamu suma yalla wajinosti Yesu Krista chaneka wajinosti damay jamu suma yalla
Sakama Baselabi Yalamidi Sumaya
Yesu Krista charika
Gamnako Gamna Monikola
Yesu jël lo namburu sopali ko yarama barkelon na binyitam sopali ko diritam sopali ko diritam Majilosti Yesu Krista chanika Majilosti Damajamu sumayala Majilosti Yesu Krista chanika Majilosti Damajamu sumayala Santona apotaria yenit na ngeen def li man lile suma yaram la lile suma deret la
What you lost TV Yesu Krista Chaneka What you lost TV Damay jamu sumayala What you lost TV Yesu Krista chaneka What you lost TV Damay jamu sumayala
Wherever you're watching us from, this is Hote Jamano, your usual program. With me, your host, Marie Madeleine Sambo Mendy, and my two partners, Gaza and Joe. Thank you very much for joining us. Tonight's program is a very important one. This is a topic that usually most people don't want to talk about it, but I will just allow my co-hosts to introduce themselves and then we'll go into. Gaza Joe. Joe Degun.
Maria ngi dégg Jo.
Déedéet.
Dégguñ Jo.
Gaza yow nuyu.
Well, good evening everyone. Yéen ñi nga xam ne yéen ay seetaan programme bi Hote Jamano suma jàng suma warugal. Tey niki ni ko Mari waxee ñu ñoo leen fi nekkal ñëwaat nañ. Last 2 weeks ago buñ mujjee jógee fii wax nañ leen ne du géej te at bi dañ pare pour bëgg a ñëw di waxtaan ak yéen parce que waxtaan ñu ñëw waxtaan fii ci programme bi waxtaan ñu am solo la war a mun a nekkal su ko defee rek di leen naa wax ne welcome to duñ dugg ci wax bi bu baax waaye li ñoo def rek mooy ma bàyyi joo tamit mu nuyoo tamit parce que foog naa fu mu nekk nii ñu ko war a mun a dégg.
Wow, thank you very much, everyone. Jërëjëf Jeff. Comme ni ko Gaza waxee xewte jamono ñoo fi nekk tey pour ñu jànga together pour ñu mun a xam suñu naataange li nga xam ne moo baax pour ñun saakaatuma feebari góor yi nga xam ne am na ci ñi nga xam ne they are over 50s. This is causing a lot of issues in their lives dañ ko prostate cancer. So am nañ kilifa goo xam ne mu ngi fi nekk tey dinañ ñu xelal bu baax a baax so ñu ngi leen di ñaan ngeen share link bi talk to people to come join and get good information about what we're really talking about. Over to you, Mary.
Thank you very much, Joe. Thank you very much, Gaza. Once again, welcome to Xewte Jamono suma jàngu suma warugal. Xewte Jamono nag fii lu nit yi di kumpo moom la ñuy penco. So comme ni ma ko waxee rek si starting bi, tonight's topic is breast and prostate cancer. So as usual, here at Xewte Jamono, we listen to people's concerns. We listen to what is affecting our society and the concerns of the people. When we get messages from people telling us this is what we want you guys to come and talk about, that's what we do at Xewte Jamono. We come, we listen to your feedbacks, we make researches, and then come back to you. So this is us. Tonight's program, we're going to talk about breast and prostate cancer. As we all aware, the C word is something that is like forbidden, or people are just scared to talk about it. People are scared to discuss about what is happening. But we want each and every one of you listening to know that it's all right. It's okay for us to talk about what we're feeling. If we're going through cancer, let's just be open to talk about it. So we're going to talk about breast cancer, which is very important. As we know, we're not going to say much, but we're just going to give you like just a little bit, and then we have a guest who is going to speak to us, who's going to educate us and tell us more about breast and prostate cancer. Gaza, maybe you want to say a few words about breast cancer, and Joe will say a few words about prostate.
Yeah, Marie, niki ni ko waxee tey ñu ngi waxtaan goo xam ne waxtaan gu am solo la waxtaan bi di breast cancer ñuy wax cancer ci ween bi waaye suñu ne cancer ci ween bi ñu bari dañ lee ne foog ne jigéen rek a war a mën a am breast cancer déedéet góor tam daf lee mën a am breast cancer ci boppam su ko defee tey niki ni ko waxee tey am nañ ki ko xam ne expert la ci liggéey loolu mooy liggéeyam te xam na lu bari ci loo xam ne mooy breast cancer waaye bu niki Marie bu ñoo wax waxi breast cancer bi man dama leen wax fii ci last programme bu nekk foog mu am loo xam ne dañ ci lee jànga lañ leen ci lee jànga man bi ma demee di seet mu am loo xam ne dama ko gis lu ma jaaxal ñuy wone ne breast cancer ci ñun ñi ci ñuul la gën a ay ñun nit yu ñuul yi soo xoolee der gu weex gi ak nit yu ñuul yi ak yeneen xeeti nit da nga gis ne ñu ne nit yu ñuul yi liñ ko am moo ëppa te mënuñu understand lu tax mu war a nekk ko xam ne ci nit ku ñuul te su dalee nit ku ñuul ki dafay nekk loo xam ne di agressif war nam lee nekk parce que xam nga suñu waxee fi breast cancer ni la commencé di ñëw dañoo ne ay symptômes yu gën a ci ween gi la ween nampal bi mu tut ak yooyu noonu yoo xam ne dafa mu génn su génnee mu dajaloo mu nekk lu ñuy wax ak tuy boo xam ne expert bi su dugasee dina gën a explain loolu parce que bu ma cee duga moo about it mu nekk ay donja boo xam ne dafa nekk ci ween bi donja boo xam ne dañ ne ku gis ku toog bi fii ne yaa ngi am donja léegi-léegi nag duy nekk donja yoo xam ne donja yu métti la soo ñuy bàyyi suñu xel ci yenn yoo xam ne suñ yaram su neexutee te ñu ngi làmba ñu gis ne am na yoo xam ne daal lii bokku ci ñun ñu daw gise ji ñi nga xam ne ñooy expert yi ñu daw gise ji ñi nga xam ne ñoo war a ñoo mën a aar parce que léegi-léegi waxtu bu ñu leen daw di dem ci lopitaan yi daf le fekk mu tardé waaye nit ki ni ko waxee feebar waaye ci uppa yëpp dañ leen ne jigéen moo ci uppa waaye dañoo ñëwaat fii ci biir programme di wax ne du jigéen da kay am breast cancer parce que ñu ni góor dañ ne mën a am breast cancer waaye ñu ngeen ne ci ban jamono nam lee nekk def leen nag léegi-léegi mu nekk feebar boo xam ne ci famille bi la ci famille bi lay jógee léegi-léegi mu nekk loo xam ne daf laa dab waaye léegi-léegi ñu ne soo demee ba mag ci nam lay ñëw waaye niñ ko waxee rek dinaa wàññi wax bi su ko defee am lii mooy breast cancer li na ñëw pour waxtaan si fii tey ak yéen tey ni ko Marie waxee nekkut loo xam ne nit warut a mun a génn pour waxee ko nekkut loo xam ne nit war naa mun a toog rek di ko nobee am na loo xam ne dañ ko fu mu nekk ni jamono yi nekk da war di génn di waxtaan ak ñu jegeñ su ko defee joo ma bàyyi la nga dugg si ci xëy na li nga wax oo ma hand over la to Marie.
Thank you very much, Gaza. Joe.
Thank you very much, Gaza and Marie. Nu ko Gaza waxee rek cancer dafa nekk loo xam ne kenn ñaanu ko yàlla pour mu am ko waaye dafa nekk feebar boo xam ne dafa nekk ci suñu biir so feebar bi ñoo wax prostate is boo xam ne feebari góor la te góor comme nu ko Gaza waxee si jigéen ñi breast cancer góor yi am nañ prostate cancer boo xam ne ci nit ci ñuul la gën a bari itam te doo tax ñu indi programme bi pour ñu mun see jànga pour ngeen xam ne feebar boobu noonu sonal na góor yi nit ñu ñuul yi because soo gisee ëppa doole bi yëpp ñu ko am yëpp nit ñu ñuul lañ about 1.4 million people you know per year so ñu try pour seet naka la ñoo mun a dimbalante and help each other so that we can take this further pour mun a dimbale suñ community. Thank you very much, Mari.
Thank you very much, Joe and Gaza. I think we've just given a brief overview of what we're going to talk about. And now we're going to welcome our guest, who's a consultant, Dr. Ewan Shawcroft. Dr. Ewan Shawcroft will be with us. He's going to talk about breast and prostate cancer. So, Dr. Ewan, welcome and thank you very much for joining us.
Thank you. Now, Marie, would you like me to share my slides now?
Yes.
Okay. Now, bear with me, please, everyone, while we do this. I'll give it a moment to load, but can you tell me, Marie, when that shows up?
Yes, it's up.
Excellent.
Okay.
Excellent. Well, thank you all, and thank you for the introductions. It's an absolute pleasure actually to be invited to talk and raise awareness about these cancers, and I can hear the passion in both Gaz and Joe's voice as they're talking about these cancers. Now, my name's Dr. Ewan Shawcroft. I work in oncology or cancer treatment in Nottingham University Hospitals in the UK. I just wanted to start by just giving a brief overview. So I live and work in Nottingham. On the left, if you can see that, that's one of my favourite places in Nottingham. It's called Woollerton Hall, and I'd recommend anyone to visit that if they do happen to be anywhere near Nottingham. On the right is the Nottingham Breast Institute, and that plays a large role in my work as I specialise in breast cancer and the treatment of breast cancer. Though as a clinical oncologist, that means I trained in radiotherapy, I trained in chemotherapy, and I trained in all the different types of cancer, including prostate and breast cancer and many others. So I've got experience of both, although eventually I'm specialized in breast cancer. So I hope that gives you a bit of an idea of my background. The aims for today was to cover breast and prostate cancer, what they are, what symptoms you could expect, and generally how they are tested for and treated. All my experience comes from the UK system, but a lot of this is transferable to other countries as well. So I want to start with breast cancer and a bit of anatomy just to so we know what we're talking about. Within the breast tissue, we have the milk ducts and the lobules where the milk is created, and cancer can develop in these areas as well as in surrounding areas, and those are surrounded by the fatty tissues. Around the breast, we have lymph nodes which drain extra fluid from the breast and prevent swelling in the breast. And these are important, as these can be areas that cancer can spread to, and we need to be aware of that. Cancer itself is an abnormal growth of cells, and that can form a tumor or a mass or a lump. In the breast, this most commonly starts in those ducts that I showed you, the milk ducts, and we call that ductal carcinoma. But it can also develop in the lobules, lobular carcinoma, as well as other areas. Breast cancer, if left, it can spread to other areas like the lymph nodes or even further in the body. And if it's spread to other areas of the body, we call that stage 4 cancer or metastatic cancer. And the key is to try and diagnose and detect breast cancer as early as possible, because the earlier we detect it, the better the likely outcomes and the more treatment that we can provide to help somebody and save lives. It's very common, and I heard some numbers being mentioned, but in the UK, breast cancer is the most common cancer, and it's diagnosed in 150 people every day, affecting 1 in 7 women within their lifetime. But it can also affect men, and I think not everyone's aware of that. It's more common in women, but men need to be aware too. What causes cancer and breast cancer? Cancer itself develops over many, many years. There's not one thing that will cause a cancer in somebody's body, but it can develop over literally decades. People can develop changes in the genetics or the DNA, the building blocks within the cells from a very young age, and that eventually can sometimes trigger a cancer. But in breast cancer, there are some things that can increase that risk. Most cancers increase in their risk as people get older, as the genetics and the DNA ages in the cells. But some things can speed up that process, like smoking and excess alcohol. There can also be a link to your family, and you can inherit some genes and genetics like the breast cancer gene or the BRCA genes, which can increase the risk of breast cancer. If somebody has had previous treatment for breast cancer, they are more at risk of developing a new breast cancer as well. Hormones are important in breast cancer, and meaning the estrogen hormone, the sort of female hormone as it's known. And there are certain things like we talk about the menopause, which is when the ovaries in the body shut down, and that happens at different ages for different women. And if it happens later in life, then that can slightly increase the risk of cancer. But as I mentioned, no one of these risk factors is the main risk, and everything can add in. So there's a lot of ways that you can make changes to reduce your risk. Being overweight is another risk for cancer in general as well, and one to be aware of. Whereas you can reduce your risk by having a healthy, balanced diet and remaining active. I think it's really important to talk about what symptoms you might get if that could suggest breast cancer. I want to be clear that developing these symptoms does not mean you have cancer, but it may be reason enough to talk to your doctor. In the UK, we have GPs, the family doctors. The most common symptom in breast cancer is a lump developing in the breast, and that might be picked up by the woman themselves, or by screening, which we'll talk about next. You can also develop a lump under the arm, in the armpit, or you can notice changes in the skin, thickening of the skin over the breast, or dimpling, looking a little bit maybe like orange peel with little dimples. And that can suggest swelling in the breast. The breast may change shape or size. And another important change is that the nipple can invert, sort of go inwards. Now, that can be a very normal thing in ladies. Some people normally have inverted nipples, but if that's a new change, then that may be something to report to your doctor. Likewise, a rash around the nipple or bleeding or discharge from the nipple can sometimes be cause for seeing your doctor. Pain is actually quite breast cancer. We might consider a risk of breast cancer. They can enter this breast screening program earlier, and they can be advised by their doctor if that's the case. Other countries likely have similar sort of breast screening programs, or they may rely on people seeing their doctors and reporting any concerns to then start testing. Speaking of testing, if somebody has any changes that are worrying for breast cancer, we do what we call a triple assessment at a specialist breast unit. So this involves an examination of the breast by a specialist doctor, and then some form of scans or imaging. And that's usually a mammogram, which I mentioned is an X-ray of the breast, or an ultrasound scan. And there's an ultrasound machine on that picture on the right. If there are any worries from those scans, they would look to take a biopsy using a needle to take a small amount of sample of tissue from the worrying area. Other tests that are sometimes used might be an MRI scan if the above scans are a bit unclear, or if that patient was being prepared for other treatments like surgery or chemotherapy. If there are further worries, if the cancer is large or causing a lump under the arm, affecting those lymph nodes, we can sometimes do additional scans like CTs or bone scans. I will just briefly go over this just to highlight some of the terms we use. But breast cancer, we test for receptors like estrogen or ER, that's estrogen receptor, progesterone, PR, and HER2. And these help to label the cancer into different types. There's the hormone receptor positive or the ER positive, the HER2 positive, or the triple negative, where all those receptors are not present in the breast. So that just helps to highlight some of the terms we use. If we catch a cancer early, then the aim would be to cure that cancer and prevent it from coming back. This usually involves surgery to remove the cancer and test or remove all of the lymph nodes under the arm. And the terms are there. We call the cutting out a lumpectomy, or a wide local excision, much more common in Black men and can occur at a younger age. The reason is unclear, but it's thought to be due to genes and genetics. And I think from the age of 45, then Black men can be advised to talk to their GP, considering blood tests like the prostate specific antigen, the PSA blood test. And I'll talk to you a little bit about that in a moment. It's actually less common in Asian men, but again, the reason for that is unclear. Some of the risk factors for prostate cancer are a family history of prostate cancer. Again, being overweight can increase the risk. And actually, it can also be associated with the breast cancer genes, mutations of those, the BRCA genes, in around 5% of prostate cancers. Some symptoms to be aware of that could be a sign of prostate cancer often revolve around going to the toilet and passing urine. You may need to pass urine more often, and you may actually get up even several times during the night. We call that nocturia, when you need to pass urine during the night. It may affect the ability to pass urine. You might have to strain to pass urine. You might find that the flow of urine is weak or keeps stopping and starting, or you might struggle to empty your bladder. Sometimes actually you might struggle to hold urine and have an urgency to pass urine to get to the toilet quickly, or even sometimes not make it in time and have accidents. Another important thing to know is that there sometimes can be blood in the urine or even in the semen. And if you're getting any of these symptoms, then you should see your doctor, talk to your GP, and they can arrange tests to see if that is if prostate cancer is concerned. The tests with prostate cancer, there's no screening program, there's no effective test that we can carry out easily to check for prostate cancer, but there is a blood test that your GP can consider. So if you went to your GP with some of the concerns that in the symptoms above, they may look at doing a blood test, but they would also likely offer an examination of the prostate. And what I mean by that is when they use a gloved finger to feel just inside the back passage just above the anus, which is where you can feel the back of the prostate and feel for any changes there. If there are concerns, then a urologist is the specialist surgeon that looks into that and tries to make a diagnosis of cancer. And an MRI scan is usually the scan that they would choose. If there were worries on this scan, then they would look at getting, again, a needle biopsy to test for cancer. The other tests, if there were concerns of spread of cancer, again, would be CT scans or bone scans. In cancer that is detected early in the prostate, the aim would be to cure the cancer. And if the cancer is low risk, actually, sometimes it's safe just to monitor and monitor blood tests and occasional MRI scans, as some low risk prostate cancers aren't at risk of spreading around the body, and we can monitor. If we call a cancer medium risk prostate cancer, then we would consider surgery to remove the prostate, or consider radiotherapy, which is high doses of X-rays that are passed through the body that are focused on the prostate. And on the right, you can see a radiotherapy machine and a gentleman in the radiotherapy treatment position, likely having a prostate cancer treatment. Just to mention, radiotherapy, you don't feel anything whilst having the treatment. It's just like having an X-ray, though you can develop side effects afterwards, but the doctor will talk to you about all of those beforehand. In higher risk prostate cancers, usually radiotherapy is the preferred, the better option. And also to mention that hormone therapy is often given alongside radiotherapy to reduce the risk of cancer coming back. If unfortunately the prostate cancer is more advanced and may have spread to other areas of the body, again, just like with breast cancer, the aim is to control the cancer for as long as possible and prevent symptoms. And the main treatment for that would be hormone therapy. And in this case, it reduces the testosterone to starve the cancer of that hormone that it often uses to grow. The chemotherapy may be used in combination with hormone therapy, and sometimes radiotherapy, again at lower doses, can help to treat other areas of cancer in the body if they're causing symptoms. Finally, again, I just want to stress the fact that if you are developing any symptoms, like we mentioned, if there are any concerns, then please talk to your doctor. And again, encourage family and friends to do that. There's nothing to be ashamed about with cancer, and I've shown you how it develops. It's nothing that you've done wrong, and it's important that we diagnose this early. So do not be embarrassed about being examined. It's a very normal part of the job for the GP. It's a painless process, and it could help save your life. And again, the earlier we detect cancer, the better the outcomes. The best source of information, again, is the Macmillan Cancer Support, Cancer Research UK, and there's a charity called Prostate Cancer UK, and you should be able to access these sites from all over the world. So that's all I wanted to talk about, and I hope you found that information helpful. But I'd be more than happy to answer any questions or have any further discussions.
Thank you very much, Dr. Ewan. That was a very insightful talk. I will just get Gaza and Joe just in case you have any questions. And the viewers watching as well, if you have any questions on what Dr. Shawcroft has just mentioned on prostate or breast, or you want any clarifications on something that he has said and it's not clear, you want him to clarify on that, feel free to send in your questions or to phone in. Joe, Gaza, do you have any questions or anything to say?
Yeah, Dr. Ewan, thank you for a very very meaningful insight information about it. My question would be, how does living habits, living environment affects does it have any means, or the way we live in our life, our lifestyles? Does it have an, I know alcohol and cigarette, tobacco, and all these things. But does it? Do we have it in food or any other stuff? Just a simple question to start with.
Thank you, guys. Yeah, that's a really good question. And as I mentioned, there are so many things that can cause cancer and can change the way that the can cause that damage to the DNA, the building blocks of the cells. And you've mentioned our lifestyles and what we do can have a big effect as well. As you saw on the slides, being overweight unfortunately does carry an increased risk of cancer, and being active, eating well, eating a balanced diet can help to reduce your risks. Avoiding smoking, avoiding excess alcohol. I'm not, telling everyone they have to stop drinking alcohol if that's something they enjoy, but having a bit of a rest during the week. In the UK, we recommend having at least 3 or 4 nights of a week for your liver to rest, and all these things can affect it. We know there are a lot of things in the environment that can cause damage to the DNA, and including pollution as well, and hopefully we can all do our part in helping to reduce that as well. But basically, yes, there's a lot of things that can cause it, but trying to live as healthy as we can and be mindful of our own bodies can really help.
Yeah, and my second question is something maybe it's about, I think it stated when I was going through it, it stated that black men are normally mostly affected to both breast cancer and prostate cancer. Do you have any, since you've been doing your studies and other things, do you have anything that you might connect to it, just to share your experience? Maybe why? Because I couldn't understand when I saw it's mostly black men or black people, dark people in dark color. Is it because of it's genetical, or is it because of where location of planet, or where is it because of the heat? That, or what is it? Do you have any idea?
So you've already mentioned genetics, and as I mentioned, it is unclear. If you read on the Cancer Research UK site, it says that although the black men are at a higher risk of developing prostate cancer, the reasons for that are unclear, but we do believe that genetics can play a role, and that's wherever you are in the world. It's not driven by the country you're in, and even in the UK, where it's not particularly hot, the cancer risk in black men is unfortunately higher, and I think it's important for the family doctors, GPs, to be aware of that, and to have raise those suspicions earlier on for black men. But the reasons are mostly unknown, I'm afraid.
Okay, Joe, should I take my last question to a little bit of discussion to him? Is it okay, Joe?
Yeah, sure.
Yeah. Go
Okay.
ahead.
When I saw the black men or people in that colored way, the people that were mostly affected to it, and I was just thinking, what's going on here? Is it because of we black people? We love to breastfeed. Breastfeeding is something that is very, very, very African that we need to do, and the woman should always try to breastfeed. And you could understand that this comes from genetical. I'm not saying young people to stop breastfeeding their kids, but is it something maybe that can be a little bit of logic? Maybe we can do our own research here.
Actually, breastfeeding can be protective, and not breastfeeding your child can actually increase risk of breast cancer. So it's a good thing to breastfeed, and breastfeeding can carry other benefits as well. There are, like I say, lots of reasons. If somebody starts their periods younger or finishes them later, they have more of the hormones in their body for a longer period of time. We have some treatments that can replace hormones, the HRT, hormone replacement therapy. That can be really helpful to somebody's health and well-being if they were having lots of side effects after the menopause. But we know it can increase the risk of breast cancer slightly. I wouldn't dissuade someone or tell someone they shouldn't have the HRT, but they should be more mindful of any changes in the breast. But yeah, breastfeeding actually is protective, so that's a good thing to do.
All right, thank you. Joe, over to you.
Oh, thank you very much, Gaza. My question is very simple. What do you think we can do as a community to help each other?
Yes, I think it's quite clear that one of the big things we can do is help to encourage people to speak out about concerns, to be aware, to not be embarrassed or shameful about changes in their body, because we all deal with different changes, don't we? And hiding any concerns about breast cancer can actually lead to worse outcomes. And you, by catching cancer and changes early, you can save lives. So I think in our communities, we just need to really encourage people to be open, to be honest, and not to be ashamed, not to be embarrassed, and to speak up and be proud of their bodies.
Yeah, thank you. Other than eating healthy and looking after yourself personally to have a good lifestyle, is there any advance in cancer research and medication that we should expect in the near future?
It's happening all the time, all the time. So we within breast cancer, which is my main area of work, we've had so many new treatments over the last 10 years, and even now in the last year they talked about tablets that can help reduce the risk of breast cancer in those at higher risk. So your GP can advise if you are higher risk. It's usually if somebody has a strong family history, and that means if their parents or siblings, brothers, sisters have developed cancer at a younger age, they might be at high risk themselves. And in breast cancer, there are tablets to help reduce that risk. So there are treatments all the time, and it's quite hard to keep on top of them all. But that's our jobs, and keeps us busy and keeps us challenged. But yes, all the time, Joe.
Yeah, final question. Since the prostate cancer is mostly on our side, what are the basics advice you could give to men?
Well, it's being mindful of often it's the what we call the waterworks, passing urine, that is the main thing that can show up. And a lot of times I'll hear men talking about, well, I'm just getting older, it's expected for me not to be able to have a strong flow or take longer to pass urine. And I think sometimes that can be the wrong approach. It is true that prostates can get bigger as men get older, and that can affect the flow of that urine through the tube that goes through the prostate. But if there are changes, then it is worth talking to your GP and getting those tests.
Thank you very much, Doctor.
Thank you.
Over to you, Marie.
Thank you very much, gentlemen. Doctor, we have a question. Somebody watching before I go into mine. There's a lady here, Ilan Bahum says, I want to know exactly the main reason of getting it. How do you avoid getting the disease? Because as it stands, she said when people get it,
Okay.
yeah,
And we're
most
talking.
people they get it. Yeah, their thoughts go straight into thinking that it is incurable. So she
Yeah.
wants to know exactly the main reason of getting it and how to avoid.
Okay. And sorry, is that breast cancer particularly, or did she say all diseases?
Well,
Breast
she did
cancer.
not specify.
That's fine.
So,
I think it's reasonable to assume that she means the breast cancer, and there is no one reason, and it's not anyone's fault to develop the breast cancer, and often we just say it can be bad luck, and we just need to make the best of that. Most breast cancers I think it's important to say most breast cancers are caught early, and most breast cancers are curable. So that we should bear that in mind. And if people are examining themselves and attending any screening that is offered, then that helps to catch changes early on. But like I say, sometimes it's just bad luck. If you can try and make changes to have a healthier lifestyle, getting fruit and vegetables into your diet, avoiding what we call ultra processed foods. A lot of fast foods might be called ultra processed. Then that is a healthier diet. Keeping active. We know that being sedentary and not moving around can also increase the risk of cancer as well. So being active and eating well.
Thank you. My question is, talking about the mammogram or the breast screening. Do I need to be at a certain age to start going for the breast screening, or sometimes like maybe I might check and I'm not feeling anything unusual when actually there's a lump, but I don't even realize that there's a lump, whether around my breast area or under my armpit. But with the mammogram, is there a certain age?
Yes. So in the UK, the screening starts at 50, and that's because the chance of cancer increases with age. If you start scanning people too young, then you're unlikely to diagnose many cancers. You're putting a lot of women through the process of screening, and we can get what we call false positives, which is when there are changes on the scans that are worrying and concerning, but actually aren't anything cancerous at all. Quite normal, innocent lumps in the breast. And the younger women do tend to have denser breasts, and that can be harder to sort of see any lumps on mammograms. But the risk of the breast cancer is lower as well. So in those women younger than 50, it's very much driven by if they notice any changes and talking to their doctors. But over 50 is when the screening starts.
Okay. I think Nicole was also asking the same question. Nicole, is your question answered? Because she just wrote, if you find a lump and you are under the age for the screening, will they still do it?
Yes. So the screening is just we know that it can help to detect the cancer that wouldn't be found otherwise. But if you find a change, whatever age you are, then you can go through the same tests and get the same treatment. So yes, just talk to your doctor.
Thank you very much. This just said in the US is 40 years.
40. Thank you.
Yeah. Thank you very much. Those watching, if you have any questions, you can just either phone in or send the questions. I think maybe doctor can give us another 5 minutes before saying bye. We go back to prostate to prostate. So for the men, like most men, I think, is it because they feel like, oh, I am macho, or I don't want to test or look after myself. Do you advise how often should they check for any unusual signs?
So with prostate cancer, it's not, you can't feel a lump because it's deep inside the body. So it's not a case of examining yourself, but it's just being aware of changes in the way that you pass urine, or if you notice any blood, don't sort of hide it or shy away. Sometimes men can be worried about the tests that happen, but it's you don't necessarily need a test like a needle biopsy. Oftentimes, if the blood tests and the scans are okay, you don't need to go any further than that, and you can get reassurance without having anything like that. But yeah, it's just being mindful of any changes. There's no examination you need to carry out on yourself from a prostate point of view.
Thank you very much.
So I would say, Marie, obviously we're talking about breast and prostate cancer, but
Yeah.
examining from a testicular point of view is also something that's important and maybe worth mentioning. And so that would be, again, probably monthly for men just to examine themselves from the scrotum and the testicles, just looking for any feeling for any hard lumps around the testicle or any painful areas, and talking to their GP, because that is something that they can do from examining themselves.
Thank you very much. I think there's no more questions coming in. Jens, do we have anything to say? There's no more questions.
All I want to say is to thank the good doctor for leaving his family and joining us today. And we've learned a great deal today, and we want to thank you. And we hope that we will see you again in another program.
Absolute honor, and thank you, Joe. It's a real honor to be given the opportunity to talk and answer questions and hopefully help people.
It was a pleasure having you here. I've learned a lot. So yeah, maybe Marie hasn't told you, but I am in the medical field as well.
Oh yeah,
So
I said to you, you
so,
are.
so that was why I was just directing my questions towards the medical side. But Joe was going out, you know. He was giving out the general questions, but we appreciate you coming here, and we would definitely love to have you back here again.
Oh, it would be a pleasure. You're very welcome.
Yeah.
Thank you very much, Dr. Shawcroft. It was an absolute honor to have you here. I know, like, I've been disturbing you every time I see you. I'll be like, oh, we have this wonderful group. This is what but I'm so glad that you accepted to come and share with us about breast and prostate. We really appreciate it, and those watching also appreciate you coming and sharing with us. Thank you so much for taking your time to share with us.
Thank you, Marie.
Thank you.
Yeah, we'll continue. Now, what we're going to do, we're going to just summarize what has been discussed here in local language for some of our viewers, to just have an overview of what has been going on. Suma mbokk yi di leen gërëm bu baax a baax rek si noo leen àndee ak ñun tey ci xewte jamono, comme niñ ko dee defee rek xewte jamono ñun fii nii lu nit yi di kumpo moom la ñuy pencoo. So ñëpp xam nañ xewte jamono, ñun duñ dee bàyyi dara loo xamante ne jaaxal na nit yi, bugga nañoo xam tamit gën a xam. Ñun dañ fi nekk pour ñu jànga ba pare ñu jàngale. So loolu mooy xewte jamono. moo taxit tey ñu ñëw di waxtaanee li nga xam ne moo di siiwoor bi boo xamante ne ñu bari duñ dee bugg a wax dara lu jëm si cancer, dañ ko dee nëbee. So di ko ñu rek si ron kapet bi, ñun bëgguñ loolu noonu. Dañ bugg a pour ñu waxtaanee, ñu jànga ba pare tamit ñu jàngale tamit. moo taxit xewte jamono ñëw fi tey nag ñaari wàll lañ doon di wax, parce que cancer moom dafa yaatu boo xamante ne mënuñoo wax lépp lu jëm si cancer tey, waaye tey dañ doon di wax rek lu jëm si cancer bu jëm si ween ak tamit prostate. waaye suñ nee breast cancer, xëj na ñu bari dañ dee toog di xalaat ne comme like jigéen rek moo ko dee am, waaye góor yi tamit dañ ko dee am. ku nekk mun naa am breast cancer. So docteur bi ñu fi amoon di docteur Ewan Shawcroft, moom loolu moo nekk liggéeyam. moom oncologist la. So daanaka li nga xam ne moo di jublukaay cancer moom loolu lam jànga. cancer ak léppalum umba moom loolu lam jànga. So moom lañ fi amoon tey muy waxtaaneek ñun li nga xam ne moo di breast cancer ak prostate cancer. lan moo waral breast cancer, moom wax na si Gaza Joe, ñoom tamit wax nañ si loolu noonu. So di wax rek ne pour breast cancer bi ñu ngi wax ne daf dee am jamono boo xamante ne di nga dem pour mammogram bi wala am breast screening bi laajte nañ ko comme ban at la daf mu ne comme xëy na juróom fukki at soo àggee juróom fukki at Amérique ñoom ñu ngi wax ne ñeent fukki at waaye tamit loolu taxul tamit ni ki jigéen war ngaa mun a toog ngay seetlu sa boppa tamit xëy na di nga dem ba yëg loo xamante ne daf la jaaxal soo seetloo nga bës sa ween ni sa ron poxotaan yi gis loo xamante ne daal dafa nekk loo xamante ne xëy na nekku fa woon demal ci sa docteur dem wax ak sa docteur moom i tamit mu seet mu xelal la tamit parce que yenn saa xëy na nekkul sax dara xëy na ndox la wala taab la rek waaye soo gisee lu la jaaxal loo xamante ne jaaxal na la rek demal ci sa docteur demal waxtaan ak moom mu xelal la laal na tamit prostate cancer dañ dee wax ne benn si juróom ñetti góor dina dee am prostate cancer waaye si ñun suñ askan ñuule dañ ne benn si ñeenti góor dina am prostate cancer waaye loolu tamit mu nekk loo xamante ne benn tey mi ngi jaaxal nit yi research ñu ngi gën a seet si loolu noonu lan moo ko waral waaye tamit lu ñoo wax rek moo nekk tamit xëj na dina am dara pour def ak suñ nu ñuy dundee comme like suñ lifestyle wala tamit am yaram yoo xamante ne moom la ñoo am yaram loolu tamit xëj na dina mun a tax tamit ñu am ci li nga xam ne moo di cancer so li ñoo lekka tamit lu ñuy dundee tamit laal na ci yooyu noonu yëpp xëj na dinaa wàññi tuuti foog naa maa ngi bugg a wax bi yëpp xëj na Gaza wala joo tamit dinañ bugg a gën a sànni kaddu xëj na am na loo xamante ne fàtte naa ko si li nga xam ne moom la am docteur Ewan wax pour ñu waxtaan bi si.
non Marie wax nga lu ci ëpp doole yëpp foog naa ne nit ki nu mu ko waxee man ci biir waxtaan bi laajte naa ko lu tax nit yu ñuul yi rek ñu ne nit yu ñuul yi ñoo ci li ëpp ak yooyu noonu laajte naa ko ci biir waxtaan bi waaye da nga gis ne jàngat mënuñoo woon lu tax nit yu ñuul yi ñu ci li ëpp ci ñu ko lee am soo ma laajte ko tamit am nampal jigéen dama ko ne ko am fooguloo ne comme que ñun nit yu ñuul dañ bëgg a di nampal suñ doom yi ak yooyu noonu am xale yi dañ koo nampal time bu ñoo nekkee ndaw parce que daf leen nekk génétique tamit loo xam ne daf leen mun a jógee ci famille mu dugg ci famille waaye wax na ma ne nampali liir lu am solo la parce que dafa ci luy jàppale ci loo xam ne mooy jàppa ci liggéey pour wàññi breast cancer ci la bokka waaye lu gën a am solo fii ci waxtaan gi ni ma ko gisee tamit mooy ne bi ma wax ne nit ku nekka sa docteur yi boppa nga mun a nekk parce que soo sa yaram yaa gën a mun a xam sa boppa sa yaram te soo toogee ba gis ne am na yoo xam ne nekkut sa yaram bi nga fil like ne lii du man ne xamewuma ko ci man li ñu laa wax rek mooy pour nga jéem a dem nga gis ci njumtuwaay yi nga dem gis ci ñi nga xam ne ñoo nekk experts yi su ko defee ñu mun laa tëral te when it comes to breast cancer ci boppam dañ la wax ne the earlier nga detect ko the better because of you have the chances pour ñu faj la pour ñu jàppale la ci li nga xam ne moom nga am parce que soo ko teelu teggi na mu dem ba dajaloo ni ki ni nga ko waxee den dafa form li ñuy wax métastase mu nekk ay donja yoo xam ne foofu la ba pare foofu noonu dina mun a tasaaroo dugga ci sa yaram bi dem ci sa long si wàcca def lu nekk ci jamono boobu nag daf lay jafe parce que already commencé na di dugga place yoo xam ne waru fa woon a dugga soo di wax nit yi rek ne dem lopitaan am solo la waaye tamit nag Marie wax bi foog ñu ñëwaate ci lifin bi dégg la fii ni ko waxee soo amee juróom fukki at mbaate ñeneen fukki at ci Amérique di nga mun a dem ci yii nit ñoom ci seen boppa ñoo laa oo ne la ne kaay nga dem waaye réew buñ dëkka ak nit ñu ñoo waxtaana pour ñu mun a gën a xam lii am nañ jumtukaay yooyu noonu tamit wax bi foog mu ñëwaat itam dina ñëwaat wàcceeti te nguur gi foog ñu am pour jàppale ñu parce que lii lu am solo la tamit when it comes to the health care tamit waaw
Gaza foog naa si yooyu noonu screening yooyu noonu foog naa dañ la dee fii ni moom dañ la dee binda sax soo demee soo àggee si at yooyu noonu dañ la dee binda pour encourage la nga dem screening yooyu noonu so ñu nge delluwaati rek gën a ñaax ñi seetaan buñ la bindee leetar ne la demal pour nga dem ñu dem ceg la demal bul lii nii bul bàyyi loxo daal bul yox demal daal ñu dem seet la Jo da nga bëgg a sànni ay kàddu yaa ngi mute.
Oh, sorry. ñun suñ boppa ñun ñoo nekk the expert of ourselves, right? So suñ finding anything wrong, anything we don't understand, the best thing to do is go get help. So nekkee yaa ngi in the UK, nga contact sa GP bi straight away. Bu leen yoxi bu leen ragal bu leen tiit, because the earlier you find out lu la jot, the earlier they can help you. waaye su fekkee ne yaa ngi góorgóorlu di dëgërlu di muñ, and by the time ñu mun a jàppal lu la jot, it will be too late. So the earlier the better, you know. So don't leave it till it's too late. The moment you find out that something is wrong, go find help. loolu laa mën a wax. So right now just pour ma yëgal leen rek xam na woon naa leen kon ne suñ jàmbaar ji agsi na Mr Motivator. Yes, Mr Motivator. Okay.
The guru is in the house.
Well, thank you so much, and you know, I also would like to thank the doctor really for coming out here today to share all this valuable information. So tey nag dama leen bëggoon a may lu tuuti from a motivational standpoint.
Okay.
Dégg na docteur bi lu mu wax te nekk na ay myths yu bari yu mu dispel yoo xam ne in community bi. But I also want the doctor to hear what I'm going to say, so it's going to be in English.
Okay.
Sorry, just before you start, Mr. Motivator, your camera is off.
Oh, is it?
Yeah.
Oh, okay. So, oh man. So hold on 1 second. Let me see how I can do this.
Yeah, you're back.
All right. Can you see me?
Yeah.
Yes. Okay. Let me put you in the cast.
Okay.
You gone?
I'm gone. I prepared something. I don't have it. But okay, I'm going to try.
You're back.
I'm back. Okay.
Yeah.
All right. So what I would like to share is that I think Gaza has touched on a little bit of it, is around the advocacy piece. And the doctor has done a really nice job talking about advocacy. And, you know, in the West, it's very easy for us to have these things scheduled. We have the routines. And we have access to healthcare, and it's readily available. That's not the case for millions of people, especially some of our brothers and sisters that live in the continent of Africa. And so it's even more important that everyone that's listening becomes an advocate. Now, how do you become an advocate? When you are at home, when you're talking to your family, when they are concerned about their health and don't quite know how to go about addressing some of these myths, right? Because, you know, there's a lot of myths, and I appreciate the doctor really clarifying that breastfeeding is not something that can cause cancer. In fact, it's the opposite, right? So when you look at that, I think some of the behaviors, when you think about some of the behaviors that really drive what we're seeing in the rise of numbers of people that are suffering from cancer, it has a lot to do with a lot of the processed foods that we eat. There's an environmental crisis happening in our continent, and we all own this. And how do we own this, right? So when we are in our neighborhoods and people are smoking and we have health hazards that are present, do we stand out and speak, or do we just ignore it and say, you know what, we just have lousy neighbors? When we see someone who has a drinking problem and they're abusing alcohol, how are we showing up to really help those folks, to make sure that we become someone that helps them out. When you look at some of my motivations and what I really set out to do, it's all about driving the individual to become a better version of themselves. Being a better version of yourself should not only be limited to mental health, it should also extend to your physical health. And your physical health, it's the exercise. It's being able to use good judgment and say, I may not, I have a choice to have fresh vegetables. I live in an environment where it's readily available. I can have fresh fish. So I'm not going to get that can of tuna or that can of processed food that is in the supermarket because we see it as Western and it looks a little bit more appetizing. But that's not always the case. When you look at what's going on, especially around some of the outcomes that we're seeing from a health standpoint, we see an erosion of behaviors and habits that a lot of us have embraced that doesn't really help and support our personal health. So I wanted to come out today and really invite you to be an advocate for yourself. Are you participating in self-care? Are you talking about environmental issues that we're seeing that are causing a lot of some of these pollution that a lot of these communities that don't really have access to active screening? But more importantly, what are we doing to encourage our government to invest in reasonable, equitable access to healthcare? Are we challenging our local municipal representative? Are we talking to our members of parliament? And by extension, are we actively seeking legislation to make access to screening universal in the Gambia? So I appreciate the doctor for sharing all of these amazing information that will save lives. But let's not stop there. Let's not stop at what the doctor has shared. Because healthcare, it's our responsibility, all of us. So when you are gone today and you're home and you are in the Gambia, for instance, and you see that cousin of yours that is sedentary, that's not moving, that's really not taking walks or having a little bit of physical exercise, invite them to a conversation, utilize some of these tools some of the information we have today to really encourage and inspire them. I'm going to dedicate a section. I did write something up and I will share it with everyone. I think it invites us to think about our mindset, because when you think about our mindset, there's a great script. Actually, it's actually talks about the body. Your body is your temple. How do you make your body your temple? A lot of these preventive measures can be really averted if we have sensible programs in schools to talk about smoking cessations. How do we encourage young people to live healthy habits where they are not spending time smoking cigarettes or smoking other things that are available? Do we have a curriculum that really talks about health education, physical health education in our schools, and how that can impact our young people so they don't suffer the same fate as their parents or their uncles or their relatives or some of the people that we know that have died prematurely because they don't have access. So in the classic guru format, I want to let you all know that we have to take care of each other. the only way we can stamp out the stigma around cancer is we have to become open and transparent so others can feel brave to come out. And when they see signs that don't align with what is normal or what is usual in their daily self-care, that they can be brave to come out and say, I am worth it enough to ask for help.
Mm-hmm.
Take care of each other. That's what I wanted to share today. Thank you.
Thank you very much. That's our guru there. Thank you, Mr. Motivator, as Joe usually calls you. Those are powerful words. Everybody, those of us watching, and even myself, just remember, I am worth it. Another thing that I wanted to talk about, Matar has mentioned it, talking about it. I know, like sometimes when you have cancer, you might like find the idea of talking about it a little bit upsetting or a bit uncomfortable. But we'll just encourage you to just reach out and share how you are feeling, and then you will get help. There are people there to help you, just to let you know that it's just okay for you sometimes to feel not feel okay, but life is different, and changes can be hard if you're going through all those things. But just remember, reach out to people, talk, and you'll get help. Help is always there. Thank you very much, Joe, Gaza.
Well, Mari, niki wahe because of man ma duga ci all of bi rek
Yeah.
niki ko wahe ak lu ko Matar just daanele that support boo nga xam ne dañ ko nit yi dañ ko soxla dafa war a nekk parce que ñun am nañ de mentalité ne su nit ki su la ne dama am cancer rek nga ne ko dee na xam nga am cancer ak dee dafa utee te nit ki tey li ñoo waxtaan ni waxtaan bu ñoo waxtaan ni breast cancer bi ak prostate cancer bi su alien nga am ñu teel ko di teg da nga gis ne mën nga am ndimbal loo xam ne ndimbal bu laa mën a jàppale la te mun na laa delawaat ci li nga xam ne mooy sa sago mu delawaat la nga mën a continuer li sa life without ngay feel pour dem di feel stress boobu noonu nit yi nag dañ lay ragal léegi-léegi ñu ne la am na cancer rek nga gis ne ki deeyaangum na ci boppam dee na pak moom ba pare balaa moo commencé ba pare famille bi ñëw instead of ñu génn ñëw support si ko nga diga next thing li ma def rek ekkati naa téléphone bi ko Mari yëg nga lu xew Matar yëg nga lu xew diw sangam de moom bi lii ak lii you know we need to support each other that the family support needs to be there.
Yep.
te pour wax nit rek ne cancer ak dee dafa utee te du benn sax so ne te di leen wax ne ni ko docteur Ewan waxee tamit mu ne since bu mu nekkee ci study si ba léegi every year mu ngi am new developments mu ngi am new medications yoo xam ne ñu ngi ñëw up and down pour rek pour aar nit yi pour make sure ne nit yi lii génne nañ ko suñu biir lii nekk na loo xam ne dinañ ko war a mun a faj so loolu laa bëggoon a aat rek ci li nga xam ne moom lañ doon discuss fii nii tamit.
Thank you very much, Gaza. Dr. Ewan, I think you're free to leave now because we're about to just wrap up. I think we've taken more than.
Well, thank you. It's been a pleasure, and I'll say goodbye. Thank you for the opportunity.
Thank you so much.
Thank you very much, Dr. Ewan.
Bye-bye.
Thanks.
You're welcome. Bye-bye.
Bye-bye. Joe.
Yes.
Yeah.
Okay.
You am solo.
Yes. Dr. Bilum wax leer na. Mr. Motivator, thank you very much for coming. Just as always, you've inspired us. Thank you very much. Come Ninkowe all together it quite makes sense that we stand up for each other. Let's not count ourselves with one of those people that are pointing the finger. Nañ nekk one of those people that are willing to help. Let's make one of those people that open our arms to people that we see that they are struggling. So now some of us, we are very experienced. We could tell someone is going through a lot just by just meeting them. You can tell. So that way we can extend our arms to help. Although naturally people might refuse or they will put up a fight, but we should be smart enough to able to walk our way around such things. Man loolu rek la am pour wax ñu dimbalante. We need to help each other. You know, it's very, very important because when someone is sick, I don't know, it's one of our instinct. We can tell straight away, you know. So let's give them a hand rather than pointing a finger.
Thank you very much, Joe. Pokna, we've touched on every aspect that we're supposed to touch. We'll just encourage all of us, as Mata said. We've heard what Dr. Shawcroft has said. So it's up to us. Do I just sit down and bottle everything that I've heard today or I've learned to myself? Is it just going to benefit me? Or do I have to go out and share? So we'll just encourage all of us to share. And if I am here watching and I've been affected by the topic that has been discussed, have I been quiet about it? Have I decided to go and seek help? Did I seek help? If I've not done that, we're encouraging you. Please reach out, seek help, talk about it. As I said, I know sometimes it's a bit uncomfortable or it's upsetting, but let's share, let's seek for help, let's talk. It can help us. Thank you very much.
Yeah, thank you very much, Marie. Bala ñoo dem further rek Gaza just remind me about few activities you know up. That is the Krista, the Easter, the Easter celebrations. They're going both for GCA Dallas and GCCS Sweden. Yeah, so ñoom yëpp ñu ngi def different activities. So next week, Sweden be starting from next week, Friday. The Deganane people have already started arriving in Sweden, Gaza. Well done. Definitely a good job.
Lo moo tax daf foog ma am pour wax dara rek ak ci gars yi parce que bi ma demee Sangmari laa see dama waxoon waa Amérique li leen waa Europe yóbbante ne leen ne ñu ne waa Europe ñu ne waa Amérique du ñoo génnaat duñ dem fenn waaye at bii nag moom ba ma ko waxee foofu noonu waa Europe waa Amérique mer nañ dañ mer gis nañ seen boppa ci wax bi bu baax a baax ñoom mataar yëpp gis nañ seen boppa bu baax a baax ci wax ba nga xam ne suñ Easter bi nii jo su ma la ne xam nga ñaata ñuy jóge Amérique ñaata expi fooguma ne Europe mus nañoo expérience loolu noonu fooguma ne any other Gambian organisation ci diaspora bi mus naa am the number of people ñuy jóge all the way from America expi te di wax waa Amérique ne leen ngàcce ngaa laa may yéen parce que man xamoon naa ne gars yi duñ ma rusdoo ba ma ko waxee daal am na ñoo xam ne xool nañ ma ci biir bët te bañ ma gars yi waxee ne dina ñëw óoroo na ma ne dinañ ñëw fu mu nekk nii nag dafa des ci ñun waa Sweden pour ñu teral waa Amérique bi nga xam ne suñ leen ne ñibbi leen gars yi dañoo ne déedéet duñ ñibbi si soo da ngaa gis ne force gan gi agsi na maa ngi monitor yëpp force gan gi agsi na waaw agsi na 16 démb la agsi fii waaye di pour ñëw wane boppam te next week nag moom dama ko wax from Monday ba Friday every day maa ngi ci airport bi Joe every day maa ngi te waa Amérique ñooy njëkk a egsi waat next week parce que c'est na first flight bi egsi Tuesday ñoom ñoo ko nekk Wednesday ñoo fa egsi balaa waa Europe di egsi fu mu nekk nii so di wax waa Europe nag ne leen ne fu mu nekk nii daal nañ taxaa parce que fu mu nekk nii waa Amérique dal nañ suñ kaw bu baax a baax a baax te ñëw nañ pour woon ñu ne daal li ñu wax daal du dëgg gars yi dañ leen mun a génn te gars yi dañ leen génn
baax na
dëgg la gars yi def nañ ko ba mu rafet ñu ngi leen di wax jërëjëf and we keep motivating people pour ngeen ñëw support Easter celebration bi dina Easter celebration rek de bu leen fàtte after the Sweden celebration ñu ngi dem GCA Dallas ñoom it ñu ngi celebrate seen 25th year anniversary bu leen fàtte pour support gars yi ak tam bu leen fàtte ne London a oote sang mari bi ma sànni ko fa rek xam naa ne sang mari jotangut waaye foog ma wax leen ko rek te nag surprise people have already inquiring about tickets so niñ ko dee waxee rek please duñ dee bëgg a jaay ticket daf dee nekk ne affaire si di capacity duñ dee am capacity so please depre area buñ dee jël yëpp dañ dee am limit so please koo xam ne daal comme ni ma ko waxee woon the last time ku bëgg a ticket rek dooral di inquire ñu bind la si liste bi because list bi ñu am léegi is very very long people are booking te xamanguñ price bi ñaata la but people are putting their names down bu leen fàtte next week Sweden and then ñun ñëpp ñu buubu ñu dem Dallas thank you very much.
no waaye jo ni ko waxee dama ne comme que egsi nañ fii foog naa ne next year sang mari bi pare leen te am na loo xam ne gis naa ko tamit parce que gis naa mare ngi toog waa Nottingham yéen it bés bi ngeen naa jël yàlla nañ ko fekkee jaama dina fekk tamit ñëpp pare nañ fu mu nekk nii Mario yaa ñu lee wax nañ ñu ne naka bale bi soo ko jëlee boole ko
waaw
soo ko bëggee dama dafa banku waaye du dam du mën a ci roccee benn daal dama ko dafa dem fu mu nekk nii yëpp bale yëpp nañoo jël boole leen fu mu nekk nii ñu boole leen yëpp parce que jamono yooyu neen soxla so suñ jógee fii dinañ dem Dallas ni ki ni ko joo waxee suñ jógee Dallas ñu ngi waajal nag London gars yi ne London nañ wax de London nañ wax de capital
kañ foofu nag laa am
affaire bi du yomba
mukk
so di delluwaat rek di wax waa Amérique ne leen jërë ngeen jëf waaye nag di wax waa Europe jërë ngeen jëf saxatuma waa UK Birmingham ñoom Caroline ak gars yi nag yaagu prom ak ñum boot ñëpp ci nekk seen gannaaw xam naa ne fu mu nekk nii yaagu tam taxaw na ci bu baax a baax yaagu ñu ngi daa wax jërëjëf waa Manchester tamit ñoom it agsi nañ parce que already gis nañ leen fu mu nekk nii Matar sax dina agsi
kañ I'm looking forward for a 1-to-1
yeah
waay
Matar a ngi poos
man mi bëgg naa leen a meet 1-to-1 so
exactly
yeah what a dynamic team here so
bon nañ na next meeting bi dañoo dem fële Connecticut dañoo dem ca Matar
waaw
kañ
noonu la ñuy def kon gars yi su defee ñu gërëm ñëpp rek ñi ñu doon sitaan tey ànd ak ñun waaye balaa ñu
Marie buñ fàttee on the 26 dama bëgg a dellu rek GPI gala bi
waaw
pour ñi nga xam ne bind nañ leen pour seen table si parce que reach out nañ to the different Christian organizations si soo gisee GPI def li because of GPI fu mu nekk nii moom nañ am ñooy diocèse bi te foog naa ne ñun ñëpp dañ war a jóg jàppa ci liggéey gi nga xam ne moom nañoo def ak Father Peter Lopez ak xale mi li nga xam ne loolu nañoo def parce que soxla nañ suñu ndimbal bu baax a baax parce que suñ ko amee ni ki nuñ ko waxee fréquence bi dañ bëgg a mu aaga ba basé fu mu nekk ni su ko defee jàngu bi mun a ubbeeku foofu noonu so ñu ngi encourage ñi nga xam ne jinaanguñ seen ticket si pour gala bi it's on the 26th of April am nañ 1 month fu mu nekk ni pour ñu gën a mën a prépare suñu bopp ba pare wax groupe si different Christian groupe si ci diaspora bi nañ génn ku nekk ñëw jëna sa diamond table ñëw ñu représental GPI ñu wane suñ bopp ci GPI parce que foog naa ne suñ luñ ci mën a def rek suñ kër yi man suma anti suma maam yi ñëpp ñu nga déglu Radio Veritas te gis nañ foog naa njëriñ bi ci diggante bu mu fi nekka gis nañ njëriñ bu mu am te gis nga ci jamono gii ñu nekka nii ci jamono koor gi ñu nekka nii dangaa gis ne niñ dajee woon ak suñ mbokki sëriñ ni konte duñ doon am any plateforme foo xam ne dinañ ñëw di wane ay Stations of the Cross o ñu ñëw play away yi gourmet parce que yàgg na ñoo dëkka ci loolu noonu waaye fu mu nekk nii am nañ loo xam ne moomal nañ ko suñu boppa te ñu ko xajaane suñu boppa soo nañ leen génn ñu jàppale GPI gën a jàppale rajo bi ak Fada Peter Lopez ak liggéey gi nga xam ne moom na moo def loolu rek laa bëggoon a teg ci li nga xam ne moo nekk ci wax bi fii ci programme bi
Gasa wax nga wax bu rafet. In fact, you know, man demoon Banjul this year, no. I really dama notice ne GPI Smile doesn't miss it. So every Mary Pie radio, and the program is really good because so holy like CTVB and all the other programs, you know, it's not local. So then you pull force, pull Japa ITV, Nigerians, you know, even though the service is the service, but relatability that's very important. So I really second that. I think ne ñu ñëpp nekk si biti ak ñu nekk si biir war na def lépp luñ mën a def pour jàppale GPI parce que man mii sax suba teel dama dee déglu seen programme si te dama si dee jàng lu bare so really great job GPI.
Thank you very much.
Thank you. Yeah.
waa balaa ñoo jeexal rek dinañ jël waxtu bii nii xewte jamono team bi di jàlle bishop bi ak diocese si Banjul presentation of Mary Sisters ci li nga xam ne moo di génn àddina bu sister Bernadette Ba jamono bii nii xam nañ ne presentation of Mary Sisters am nañ lu leen miti ñun ñëpp ñoo ko bokk si diocese bi si naxar bi nii di leen a boole rek ci suñu ñaan di ñaanal ki nga xam ne jiitu nañu dee doon na flyam.
Amen.
maanaam foog naa kon li ñuy def gaay yi di leen a gërëm bu baax a baax yéen mi àndoon ak ñun fii nii ci turi xewte jamono man fu mu nekk nii nekkatuma xëj na ci ñi dee ñëw si kanam fii nii man maa nekk benn ñebe si biir cin waaye suñ seetloo léegi suñ team bi am nañ Paulina foofu noonu am nañ Mr Motivator the guru himself Matar Gaza Goswell Joe fele nele suñ technical man bi ñu ngi leen a gërëm waaye nag tamit duñ fàtte tamit suñ jëkkër yi ak suñ jabar yi ndaxte suñ jaar-jaar yu ñuy jaar yëpp suñoo pareyaas pour ñëw online suñ jëkkër ak suñ jabar yi xam naa ne moom dinañ dee doylu parce que waxtu bu nekk benn ñaar kiriring ñu nekk si téléphone bi di wax waaw yow def nga lii def nga leen su ko defee duñ amati time suñ jëkkër yi wala suñ time jabar yi parce que ñooñu dinañ nekk di wasa waaye lu ñuy def moom duñ dee dégga sax kenn du si nag kewre moom tamit sonal nañ ko ba bëgg a dee su ñoo tes leen kewre kaay Fodwell tiyeen soo ñu ngi leen gërëm bu baax a baax waaw xam nga dañ dee wax ne ñu ne boo demee pour sëy dañ dee wax ne for better for worse man dam dee wax kewre ak Fodwell every time da ngeen ñoo baala rek xam naa ne xewte jamono moom buñ jógee moom dinañ leen dee gëteen waa this is for the worst ngeen baalal ñu rek ngeen ko nekk for the worst parce que su neexee moom génnee waaye ñu ngi leen gërëm bu baax a baax yéen moom amuñ seen fay suñ jëkkër yi suñ jabar yi mama si fele ne le Mrs Sadiaw amuñ kenn si yéen seen fay di leen na ñaanal rek yéen tamit yàlla gën leen na barkel yàlla gën leen na may xol pour ngeen ñoo muñal rek di ñu ñaanal ñu ni tamit ci li nga xam ne moom la ñu def parce que xam nañ ne soo leen ñu support toon tamit suñ amutoon seen 100% support xewte jamono du doon di mën a taxaw soo jërëjeen jëf waaw
yeah thanks everyone
jërëjëf waay
all right ciao
guys thank you very much
waaw balaa ñoo jeexal fàtte naa sax next week is Holy Week xam naa xewte jamono moom doo leen ñu gis ba after Easter bi waaye ñu ngi leen na ñaan rek Holy Week bu sell waaw ba pare tamit di leen na wax rek ne Easter baa ngi ñëw tamit di leen na ñaanal Easter bu neex waaw ñu ne bu naree ñaaw rek nañu ren ginal waaw jërëjëf.
Wassalam. Thank you very much.
Thanks.
Thank you everyone. Suñ viewers itam ñu ngi leen di wax yéen yëpp jërëjëf. Yaakaar nañ ne programme bi interesting na yéen yëpp.